So welcome to MDA's COVID podcasts, where we'll be covering different topics around the pandemic. Today, I'm joined by Dr. Masood Ahmed, Chief Medical Officer and Chief Clinical Information Officer for NHS Black Country in West Birmingham CCG, serving and commissioning for a population of 1.5 million in the West Midlands. Dr. Ahmed's former roles include Global Medical Director at Dell Healthcare and Life Sciences, Chief Digital Officer at the Health Innovation Network, Chair of Negotiators for the British Medical Association Junior Doctors Committee, and Senior Advisor to UCL Partners in Digital Health London. Dr. Ahmed's a digitally focused healthcare leader with business acumen, a clinical background, and over 20 years of international healthcare experience. His special interests include systems leadership, strategy, quality improvement, digital transformation, innovation, and AI. Thank you for joining us today, Dr. Ahmed. Today we'll be talking about the vaccination rollout in the UK. To start with, can you give us a brief overview of the programme and how the rollout has been going?
Of course, thank you for having me, and thank you for giving me this opportunity to share some of my thoughts and experiences. It's been an interesting one. So in terms of the rollout, I'm part of the CCG, and as a clinical commissioning group, we sit at a system level, which means that we cover an area, as you said in the introduction, that serves 1.5 million people. We cover the cities of Wolverhampton, Walsall, Sandwell, and Dudley. And so it's quite a large area. And in terms of the population, it's a very mixed population. So we have about 65% who you would class as sort of white, and the other 35% is very diverse. And we have a significant Muslim population as well in areas such as Dudley and in Walsall. In terms of the rollout, when we first found out that we needed to get ready for the vaccination program, it was actually in November. So we had about a month or just over to get ourselves ready for the beginning of December. So as you can imagine, it was a huge logistical challenge. And that month was spent working out who would be managing our delivery site, where they would be, how we would staff them. We had to look at the sort of the digital capability we did in terms of connection and the right kit, but also we needed to work out how we would record these and what systems we'd be using, because these were all being developed in a very short space of time. So the actual planning before things kicked off was extremely hectic. And then, we kicked off in December, early December, and we had different waves of GP practices that were organized as sort of PCNs, primary care networks. So a group of 5 or 6 practices would come together as a PCN, and then each PCN would have their own site. And that was, we did well. Alhamdulillah, we had, I think, close to 30 sites that went live by the end of December. And really, once we got moving, it was a huge effort from all the staff, all our GPs, primary care staff, truly remarkable. And really, since then, it's been a very intense program where we've been delivering as much as possible in terms of first doses across the region. And I think, we're close to, I'm trying to remember what the numbers, but we're over 400,000 in terms of our area and first dose. And I think we're close to 500,000. So we've managed to provide a first dose to over a third of our population. But it's been, it's certainly been a challenge.
It sounds like all of the teams collaborated together to get the rollout going. And have the government targets in your local area been reached in terms of in comparison to the national numbers?
So that's an interesting one when you talk about targets, because I think in terms of what we've delivered, we've been very good. And so we managed to get our care homes done, and most of our populations actually we have hit those targets, or we're very close to them. But I think within each cohort, there's always a little bit of, if you like, of a gap in terms of, you know, getting to the right level. And I suppose our attitude in the Black Country in West Birmingham has been leave no one behind. So if you were to ask what our target is 100%. Now, that's been a challenge because I think we have a number of different communities that are, if you like, they've been more of a challenge to engage. And I think there's been hesitancy in some of those groups. But at the same time, I don't want to say it in a way that I'm judging them. Actually, I think they're often, we've learned along the way that there are legitimate concerns. And so I think there's one aspect, which is, if you like, misinformation. But actually, we found that a lot of people who have been hesitant, it's been because of concerns. And so we've had to work very hard in terms of addressing that. But in terms of targets, we've made very solid progress. And I think that's been reflected by, if you like, the commitment and the enthusiasm of our staff in delivering the vaccination program.
That's great. And you said the whole rollout started in December, and most people have received the first dose, and now some people are in time with receiving their second dose. So what's the logistics? You mentioned the logistics challenges with the first dose. How is it going to work with people receiving their first dose and those who are now in time to receive their second dose?
Yeah, so from a logistics perspective, it does require a lot of organization. And one of the things that we've learned is that, you know, our primary care delivers the flu vaccine every year, and they do thousands and thousands of flu vaccine, and they're very well equipped and knowledgeable about how to engage with communities and deliver these kind of programs. And so in terms of managing, what we've done is we've not been too prescriptive. So at a CG level, we help coordinate, we provide support, but we try not to get too involved in the detail, because every building, every site is different. And so really it comes down to those that are at those sites working out how do they stream the patients to ensure that those that come in for their first dose get the first dose, those that come in for the second dose are recognized as being second doses. We ensure that the checks are in place to make sure that we've gotten record as having the first dose, and also ensuring that they get the right second dose. So if they've had Pfizer for their first dose, we need to make sure they get Pfizer for their second dose. If they've had AstraZeneca as the first dose, we've got to make sure they get AstraZeneca as their second dose. So it's really a lot of local knowledge is required in order to ensure that we have things set up in the right way.
And any clinics or vaccination centers have been particularly more successful than others, or have had success stories in engaging their local communities and in achieving or reaching out to a large number of people and for them to have the first vaccine?
Yeah, and I think this has been part of the learning process. So what's been really good is a number of communities have actually come forward to support the work we're doing. And so, you know, certainly from a faith perspective, we've had a number of mosques that have come forward and said, look, we'd like to help in terms of the vaccination program. So locally in Walsall, one of the main mosques in Walsall, we set up a pop-up clinic, and we were able to actually vaccinate local community within that setting. And actually what was really good was that a number of the faith leaders as well, the Imam and many others, they created a video and have shared that amongst their networks. But also on Fridays at Jummah time for the khutbah, they would also kind of reiterate that it is incumbent upon us, if you like, to be responsible to take care of ourselves and our neighbours. And so we've had a huge amount of support, if you like, from local communities and local leaders. And I think that's made a real difference, actually, because, again, sometimes it's that visibility, and when the community can see that you're working together with local leaders, that really does help.
No, it's a collaboration, said, working within the communities. And would that be have they addressed some of the concerns, said the vaccine hesitancy that some of the communities have had, or certain concerns? Have those been relayed? Like, what have the underlying factors been in terms of vaccine hesitancy in certain communities? And has the involvement of these local leaders helped in increasing the uptake of the vaccine?
It has, and I think, the way in which we've communicated and addressed those concerns has been in different formats. So, in the mosques, it's all on webinars, and I'm regularly doing webinars locally, but also to others, sort of, nationally. And part of that is really being asked those questions and being able to answer them. And what we found is that people who are non-medical. What they don't want is for their concerns to be dismissed. They want them addressed. And so we've been very careful in terms of giving them the facts. Also, in terms of messaging, we try and simplify the messaging, but we don't dumb down. So, sometimes it's just the language and how we communicate that's the issue. And in terms of answering those concerns, some of the questions have been around sort of misinformation around, the chip. Is there a microchip in there? Is there, 5G is involved? And so those are fairly easy to dismiss. But then you've got other practical questions, such as, is the vaccine considered halal? And what are the ingredients? And are they acceptable if you're a person of faith? And those are, again, we've gone to various trusted sources. So the Muslim Council of Britain, the British Islamic Medical Association, they've all discussed these questions with scholars and with people that are academically qualified, so scientists and medics, and they've all supported the view that having the vaccine is it is halal in that sense, and so we sometimes address those concerns. And then other concerns have been about, the actual vaccine and the nature of it and how it's been created. And so concern about how do we develop it within a year when a vaccine normally takes 10 years. And so we're explaining that process of how it's worked in parallel and no corners have been cut. And actually we have the strongest regulations in the world in the UK. So, these vaccines have passed through all of those regulatory checks. And so that's been important to just talk to people and answer their questions and explain how that's come about. But also a question that often comes up is around fertility. And, is there a risk to sort of fertility for young women? And we've had to address that and explain that, vaccines, one, they don't work in that way because they are there to, if you like, they work on preparing the body for infection, but they don't actually get involved in any of the physiological processes around fertility. And that's true for all vaccines. So vaccines, as a whole, they don't affect fertility. But again, people wanted to hear that rather than just be dismissed and be told, oh no, it doesn't impact fertility. They've wanted that extra bit of information. And so we've tried to provide that in webinars, but also we've produced a lot of material in different languages that are accessible. And those can be accessed either from our NHS sites or from local authority sites. So information in different languages. So it may be that it's needed to be written in Arabic. It might be in Urdu and Hindi and Punjabi. Multitude of languages as well. Because I think, again, it's really ensuring that we have provided the right information in the right way. And we've also done, radio interviews and radio ads that are in different languages. And we've, shared videos, which then can, be shared amongst people on different platforms, whether it be WhatsApp or Facebook. So we've really tried to ensure that we've connected with as many people in as many different ways as possible to ensure that that information is available and we can challenge some of the misinformation that is around.
So it's, yeah, it sounds like a lot of misinformation and the risk of that spreading via social media, and it's, well, working on addressing the concerns of the people and combating these, I guess some of them that have been conspiracy theories that have been produced. Would you say if someone's really convinced, or how to change that, if someone's thinking or still using the arguments that are coming through, for there's more every few weeks a new news article comes out. The other thing that might not be helping the vaccination program is there's a private clinic a few weeks ago that was advertising selling the vaccinations to the public.
Yeah, absolutely. I mean, we have to ensure that the public are aware that, you know, vaccinations are available, they're free, and actually they're available to everyone. Again, we've got some vulnerable communities. We have groups that, you know, here as refugees or as asylum seekers, and we want to tell them that, look, you are all entitled to having the vaccine. And certainly we don't get involved in terms of reporting anyone, or there are no risks in that sense. We are here simply to provide a service to each and everyone, and to provide them with a vaccine, and that there is no room to pay for a vaccine under any circumstances. But it's important that we try and keep that messaging out there so that people understand. And I think a lot of it is really, when it comes to misinformation, we don't try and convince anyone. I think what we found is when you try and convince someone, it makes them more resistant. So what we do is we basically listen to people's concerns, and then we answer those concerns as best we can, based on the science, based on what we know, based on the information we have, based on the evidence. And sometimes we may not have all the answers. So we have to be honest about that and say, you know, we don't think that X, Y, or Z is going to happen, but equally we're waiting to see what the evidence is. But I think the main thing is that, you know, when you think about the impact on healthcare, there are two things that have had the biggest impact on saving life globally. The first is clean water. The second is vaccination. And so vaccinations are part of our daily life, have had impact in terms of protecting us globally. And this is just another example of why we are fortunate, alhamdulillah, to have a vaccine available. I've been, you know, in my role, I'm very close to the reporting that goes on a daily basis. And I've seen the impact that it's had on our hospitals and on our critical care units. And I have to say that, you know, had we not had the vaccine, this winter would have been a lot worse. And I think we have only just about managed to weather the storm and get through this. And now we're seeing a decrease in the numbers. Saying the loss in life has been tremendous. You know, we have as a country, as a society, we've suffered hugely. And it's important that, you know, when we talk about the vaccine, it really is not just about protecting ourselves, but it's protecting our loved ones and our friends and our neighbors. And thing which I hope our younger adults appreciate, because I think our challenge moving forward is going to be that a lot of young people are perhaps not going to think that they need the vaccine, because they'll say, we're young, you know, we've already had the infection, it's not going to affect us, and not the ones that are going to suffer. Do we need it? And all I would say is that, you know what, there's more to COVID-19 than simply getting really ill and being admitted to hospital. I mean, that's one thing that the vaccine will stop. But also, in terms of the symptoms, we are seeing an emerging picture of a number of people developing long COVID.
Mm.
And with that, people can have fatigue and sort of, weakness. And we still are learning about long COVID. And so there are risks, even if you don't get really bad and get admitted to hospital. So in that respect, it's important to let people know what the risks are. So that I think what I would say is that people should just make an informed decision. And an informed decision means go to trusted sources.
Mhm. Mhm. And trusted sources, and as you said, you've mentioned a few of the leaflets and the webinars that you and colleagues have been producing and the scientific papers and journals to access.
Yes, absolutely. If you go to the NHS websites, if you go to the local authority websites, the British Islamic Medical Association has done some great work in terms of putting together material questions. And I often refer to the work that they've done because they've done a really good job in kind of answering a lot of the myths and also providing advice in terms of background and so really when I say trusted sources, those are the ones that you can get online. But also, if you've got concerns, go and talk to your GP. Go and talk to your GP. Go and talk to other healthcare professionals, and they'll be able to give you that sort of those informed answers in terms of your concerns. But I think it's important that we understand that people do have hesitation times and they are concerned because they're still quite new. And that's okay. I think the important thing is that we discuss those concerns and we try and address them and provide the information so people can make informed decisions.
One concern I think is some people have been asking is, do we anticipate that we're going to have an annual COVID vaccination just like the flu vaccine?
That's a very good question. And I would say that while I can't be sure what will happen, if you ask me what my opinion is, I think likelihood is that we will have a recurrence, or we will have another wave, if you like, in the autumn and winter. I think what we don't know is the severity of that. And the other thing we don't know is, at the moment, we don't know how long our immunity will last. But I wouldn't be surprised if having a COVID vaccination is similar to a flu vaccination. And so I wouldn't be surprised if we end up going through this process on an annual basis.
And do you think then that some people are hopeful that COVID will end by this autumn, or some have predicted April 2022? Is that a realistic expectation? Or I'm not sure.
I think what we will see is hopefully we'll see the numbers drop so that over the summer we have some sort of return to normality. But I fear that actually time we will see a recurrence. In terms of COVID disappearing, I'm not sure that would be the case. Now, what I don't know is, and this is again part of the research, is to see what the patterns of infection are. And so is it possible that COVID could end? Yes, it is possible, but I'm not sure. And I think the key thing is that we know that vaccination helps. We know that social distancing and wearing a mask and hand washing, all of these activities help. So I think these are things that will continue in some capacity in the future. What we don't know is whether COVID will last, whether it will disappear, and how it will reappear. So I think those are things that we have to keep an eye out for. But I think at least we have a vaccination, so we at least have an opportunity, if you like, to protect ourselves from infection.
What do you think is going to be the biggest challenge in reducing the number of COVID infections between now and next autumn?
I think the biggest challenge is the one that we are already on, that we're already facing, and that is ensuring, one, that the population as a whole gets vaccinated, and two, ensuring that our vulnerable groups and vulnerable communities get vaccinated. So ensuring that those that are hesitant, we give them the right information, and we address their concerns. And I think this goes beyond just COVID. This really does tap into the idea around health inequalities, because what we're seeing is that it's our most deprived populations that are the most hesitant or have the lowest uptake. So I think there's a lot of work for us to do moving forwards in terms of addressing those inequalities as well, and ensuring that we understand how we can best support our most vulnerable.
Thank you, Dr. Ahmed. That's what we've got time for this evening. But thank you so much for all the valuable insight you've given us about COVID and the vaccinations and the rollout.
And thank